I'd like to read out a question that has been sent to me via email. Okay, it goes like this. Dear Dr. Cheng, I have gone through your experiences and I'd like to know below my wife's ligaments damage. Full stop. 15 days back, my wife fell from 2.5 feet height and hit the knee. Taken X-ray and MRI. MRI said that there is mild joint effusion as well as a thickening of the posterior cruciate ligament, which shows altered signal changes. The anterior cruciate ligament is intact and normal with normal signal characteristic. The impression by the radiologist was a PCL injury with mild joint effusion. Now, the question is whether you can help me to get some small idea about the mentioned impression, whether it would be better for me to take further decision about her knee at present. I don't know what can you edit that out? The patient wants to know what should be done. From the question, mechanism of injury is fall from about 2.5 feet, landed on the knee. So the knee fell and it go pop. And MRI shows thickening of the PCL. PCL is the posterior cruciate ligament. Now the knee has 4 big ligaments. The one on the outside called the lateral ligament, the medial ligament. Inside the knee, the front is called the anterior cruciate ligament, very commonly injured in footballers. And at the back, we have a big ligament called the posterior cruciate ligament. This is called a PCL. When the person fall onto the front of the knee or sitting in a car, have an accident, the knee hits the dashboard, there's a posteriorly directed force. Now, this posterior directed force can break the PCL. When the PCL is torn, the patients, when they lie down in 90 degrees, the knee will set backwards. How much is set depends on how bad is the injury. Generally, people with PCL injury, they have less disability compared to somebody with an ACL injury. But the common things they complain about, increased pain in the front of the knee. Why? With the knee going backwards, there's increased force on the kneecap. You can see the kneecap has less force, but when you go backwards, the force on the kneecap is increased. So there's a higher chance of patellofemoral pain, which is kneecap pain. And over a long period of time of 20-30 years, patient may complain of arthritis in the kneecap. Secondly, we do see increased incidence of meniscal injury on the medial aspect of the knee joint, as well as thinning of the joint space associated with cartilage injury. So that is something we observe in people with PCL injury. Some patients whereby the ligament injury is quite serious, they even have problems of instability. They find that when they do sporting activities, the knee doesn't feel strong, it feels like buckling. So, treatment of PCL injury, if let's say it is a mild injury, it depends on the grade. If this is the shin bone, this is the thigh bone. Normally, there is a step between the thigh bone and the shin bone. This is normal. If it is a grade 1 injury, the shin bone set backwards a little bit. This can be treated without anything, just physiotherapy, strengthening of the quadriceps muscle, thigh muscles. Generally, patients do very well. So that's for grade 1 injury. So this is normal, this is grade 1. For grade 2 injury, the whole shin bone has now sunk backwards and in alignment with the knee, and you find that sometimes these people may have more symptoms, and we can consider surgical reconstruction to bring it back to normal. And thirdly, you have a grade 3 injury whereby the shin bone go beyond the knee joint, the condyle of the knee joint. And in these cases, generally, we have to suspect more than just the PCL is torn. Maybe the lateral collateral ligament may be torn, or the structures on what we call the posterolateral aspect of the knee joint may also be torn. So for this gentleman, the way to answer his question is, if the injury is acute and if it's a grade 1 injury, the wife needs a splint, a brace, PCL brace to keep the shin bone in a reduced position. After 6 weeks, there's a chance that it may heal. If the ligament injury is grade 2, if asymptomatic, just physiotherapy. If symptomatic, can consider surgery. If it's grade 3, generally there is more than one ligament injured. We have to diagnose the other ligament injuries, and generally they do need surgery.